this lesson, we will demonstrate a few of the procedures you might be delegated.
As with all your delegations, be sure to go over the procedures with your delegating RN. Each client has different needs, so procedures will vary from person to person.
Let's start out with the easy stuff, like eye drops.
As with any procedure, the first step is to evaluate the client. Talk to them about what you're going to do. Ask them how they're doing and see if they're experiencing any changes in their condition.
If the client has more than one eye medication, explain to them that you will need to give the medications at least 5 minutes apart.
Step 2 is prepare for the procedure. This is done by first reviewing the delegation instructions and the medication record. Wash your hands thoroughly with soap and water. Take the time to dry your hands thoroughly as well. Put on a fresh pair of gloves and prepare the necessary supplies.
Assist the client to a comfortable position, either sitting or lying down. For safety's sake, do not administer the medication with the client standing.
Clean the eyelid and the eyelashes using a clean, warm washcloth. When cleaning the eye, wipe outward, starting from the area closest to the nose. Step 3 is completion of the procedure. Give the client a dry, absorbent tissue, and to keep them from blinking, ask them to look up toward the ceiling. Place your thumb or fingers on the client's cheekbone, just below the eye. Gently draw down the skin on the cheek. Approach the eye from the side and instill the correct number of drops onto the outer third of the lower conjunctival sac. The conjunctival sac is the area inside the lower lid. Hold the dropper 1 to 2 centimeters from above the sac, taking care to prevent the dropper from touching the eye.
If you are administering ointment, discard the first bead from the tube.
Hold the tube above the sac. Squeeze 2 centimeters, about 3/4 of an inch, of ointment from the tube, working outward.
Instruct the client to close the eyelids, but not to squeeze them shut. Closing the eye spreads the medication around the eye, while squeezing can cause injury or other interference.
For liquid medications, press firmly or have the client press firmly on the tear duct for at least 30 seconds. This prevents the medication from running out of the eye and down the duct. Clean the eyelids as needed, wiping gently from the inner corner of the eyelid to the outer corner. Assess responses immediately after administering the drops or ointment, and again after the medication should have acted.
Wash your hands thoroughly.
Document the medication administration. Observe the client's response to the medication, watching for any side effects according to the instructions given by the delegating RN. The next procedure we will cover is dressing changes for wounds.
As with any procedure, the first step is to evaluate the client. Talk to them about what you're going to do. Ask them how they're doing and determine if they are experiencing any changes in their condition.
Step 2 is prepare for the procedure. This is done by first reviewing the delegation instructions. You should then wash your hands thoroughly with soap and water. Take the time to dry your hands thoroughly as well.
Put on a fresh pair of gloves and perform the procedure as necessary.
First, remove the old dressing and dispose of it in an appropriate container. Remove your gloves, wash your hands, and put on a new pair of gloves. Cleanse the wound as directed by the delegating nurse.
Apply any ointment or medication, again, according to the delegating RN's instruction. Apply a new dressing.
Finally, remove the gloves and wash your hands.
That's a lot of hand washing.
True, but we need to be very careful about spreading infection.
I've noticed my hands get really dried out from the gloves and so much hand washing, but using lotion every day seems to help.
The kinds with moisturizer really do the trick.
What should we be looking for when changing a dressing?
That's a good question. Documentation of wound observation is very important and should be detailed in the client record. You should document your observation of wounds as often as the delegating nurse requires. You should make notes of the client's general complaints and be aware if they are eating well and drinking plenty of fluids. After you clean the wound, you should observe the drainage and make notes about the color, any odor that persists, and the amount and consistency of the drainage. Look at the size of the wound and describe it as being close to the size of something familiar, such as a dime or quarter. You don't need to be exact. It's simply important to have a consistent measure. Identify the color of the wound and describe the wound edges as being circular or irregular in shape. You should always notify the nurse as soon as possible if there's an unusual change in the appearance of a wound.
That's all there is to it. It seems like a lot, but after a few times it goes like clockwork. What's next?
Glucometer or blood sugar testing.
For clients with diabetes.
Right. A glucometer is a machine that measures the sugar content of a person's blood. There are many different kinds of machines available, so be sure that you understand the one your client uses. And the first thing we always do?
Evaluate the client.
Right again. Find out how they're doing. You can ask them where they would like you to draw their drop of blood from. Obviously, you don't want to use a swollen or injured site, and it's a lot easier if the area is warm. Step 2, prepare for the procedure. Review the delegation instructions and wash your hands. Gather the equipment you need and put on a fresh pair of gloves.
Step 3, complete the procedure.
Puncture the skin as directed by the delegating RN. The best practice is to change the puncture site for each test. Perform the test according to the equipment you are using and instructions from the RN. Provide direct pressure to stop the bleeding if needed.
Remove the gloves and wash your hands.
Step 4 is to document the reading with the date and time and any other information required by the delegating RN. Step 5 is to observe the client for irritation of the puncture site. And that's all there is to it.
I remember it seemed kind of scary at first, but now it's pretty easy to do. I like to make sure I'm following the steps correctly, so I'm careful to review the delegation instructions every time.
That's a good idea, for safety's sake. The last procedure we're going to cover is gastrostomy feedings. A gastrostomy is an opening from the stomach to the outside, through the abdominal wall. This allows the person to receive food, fluids, or medications through the tube. There are 2 types of feeding tubes. One kind is the nasogastric, or NG tube, which reaches the stomach via the nose and esophagus. The second kind is a gastrostomy tube. This is inserted through the abdominal wall directly into the stomach. These tubes are called a variety of names and are surgically inserted, often under a local anesthetic. Eventually, the tube could be replaced by a Foley-type catheter or button.
When administering nutrition via a feeding tube, remember that this is the client's mealtime, so be sure to ask them about their preferences. Find out if they would like to be around other people or would like privacy. Be careful when moving, bathing, and dressing a client so that you don't pull on the tube.
Report any discomfort and watch for skin irritation around the abdominal insertion site.
Sometimes a client can have food in their mouth for taste, but are not allowed to swallow. If tasting is allowed, ask the client what foods they would like to taste.
You should notify the nurse if vomiting or a lot of burping occurs. Verify in writing with the delegating nurse the process for feeding, the amount of water, flow rate, and what position the client should be in when receiving liquid feedings.
While evaluating the client, explain what you're doing and ask them to tell you if they experience any discomfort.
Prepare for the procedure. Remove the dressing carefully. Don't use scissors because you might cut the tube. Complete the procedure as instructed by the delegating nurse. Anchor the tube. Flush the feeding tube with water before each feeding or administration of medication.
Administer the formula or medication.
Flush the feeding tube again.
Remove your gloves and wash up.
Step 4 is to document the feeding, and Step 5 is to observe the client for any complications.
I know these demonstrations are just to give us an example of tube feeding, but do you have any general tips and suggestions?
While each client is different, there are some pointers that you might find useful. Have the client sit upright or at a 30 to 45 degree angle while tube feeding and maintain this position for 1 hour after feeding has been finished. Observe the client's mouth for any signs of dryness or breakdown. Encourage them to brush and use mouthwash or other mouth freshening products like saline swabs.
Remember to have the client sitting up and tell them it's important to not swallow. You don't want them to choke.
Diarrhea can occur because of the dumping syndrome, a rapid emptying of the stomach contents into the small intestine. If your client has this problem, report it to your supervisor and the delegating RN. Keep things sanitized by always cleaning the equipment as directed.
With so much to think about and attend to, what are the most common complications we should be aware of?
Well, first, the obvious thing is that the tube accidentally comes out, or fluids from the stomach can drain out and irritate the skin around the site, or the tube may become plugged. You and the delegating nurse need to decide who should be called in the event that one of these complications should occur. Your client may have specific things the RN wants you to keep an eye out for.
That's it for the demonstrations.
Again, this video segment is meant only to provide you with some good practices suggestions for the most frequently delegated procedures. You need to go over your delegated procedures with your RN for each of the clients you work with.
More than anything, we want you to remember that procedures need to go according to an established plan. The first step being evaluate the client. Step 2, prepare for the procedure. Step 3, complete the procedure.
And steps 4 and 5, document and observe.
Congratulations! You've completed the video portion of this training.
Keep up the good work.